orders. As an LPN, you will be implementing a lot of orders. When working at a facility, there are usually in-house doctors that you will be communicating with. Each doctor will have their own personality and pet peeves. Some doctors will be very nice, and most of them are. Others won't be as nice, and other doctors will be downright rude, cuss you out, and even hang up in your face if they perceive that you are coming at them incorrectly. This isn't right, but just because it isn't right doesn't mean it can't happen. I've seen it happen to nurses in the past when I was a certified nursing assistant. I've seen nurses even burst out into tears after a good tongue lashing from a doctor, okay? But in my experience, working with doctors, even the ones who are known to be a-holes, they will usually tone it down a few notches if you approach them professionally. And what I mean by professionally is to make them do less work by using your critical thinking skills and a few tools. That may be the issue behind the frustration of the doctors. When you don't provide enough information, you are wasting their time, they may think, and so don't make them dig for answers. Have everything already ready for the doctor when you pick that phone up. Have the most basic information ready, like the patient's name, room, phone number, date of birth, diagnosis, lab work, current medications, especially heart and seizure medications, allergies, vital signs, and health history at the least. Don't assume that when you call that doctor, they will automatically know everything about that patient or be sitting at a computer with the patient's information pulled up or ready to be pulled up. Most of the time they won't. Doctors are very busy, just like nurses, and they have lots of patients just like nurses. You want to paint a picture of what's going on with that patient, even if the doctor cannot pull up the patient's information at that time, because the doctor will make a decision sometimes based on what you are telling them at that time, and that decision will become an order, which now becomes a legal document in the patient's health file based off of what you did or did not tell the doctor. I would suggest having a template to go by, which includes SBAR. SBAR stands for Situation, Background, Assessment, and Recommendation. Let's go through them. Situation. What is going on with the patient at this time? For example, a 52-year-old patient has lower left extremity trace edema. Background, what is his health history? Essential hypertension and has never taken diuretics. Assessment, what are your findings? Is there pain and heat to the site upon touching? Is the swelling a new onset? Does the patient deny chest pain? Is respiratory even in unlabored? Are the vital signs normal according to what's normal for that patient? Has the patient urinated in the past 24 hours? What are the lab work results if they have already been ordered? These new findings can lead to new diagnosis going forward and new orders. Recommendations. What would you recommend to the doctor as the nurse? A urinalysis, CBC panel, Doppler study, 24-hour urinary collection, metabolic panel, or even a small dosage of a diuretic. The SBAR tool can help you collaborate with the doctor. If you don't have one at your disposal, there is one in the description area that you can download to your computer for free. Just print it out, and all you will need to do is fill it out at the time that you need it so that you can use it to relay the information to the doctor. Also, you may want to lock that physician's phone number in your cell phone, because there will be a lot of times when they will call you back with orders and you don't want to miss that call. You also don't want to rely on facility staff to pass that information to you, especially if there is no unit secretary, because you may never get that order. Trust me, after you've done everything that I've mentioned and you still get a rude doctor, because some doctors will just be rude for the sake of it. This is your chance to develop thick skin by saying to yourself, this is about the patient, not about my feelings or the doctor's attitude, and stay professional. Even if you feel the need to ask the doctor to treat you with some respect, but do it in a way that is respectful and professional. If they start to call you names, you have the right to hang up and walk away. Don't accept abuse at any cost, but don't stoop to their level, or don't have a shouting match with them. Just stay focused on the patient, and by all means, stay professional. Is it hard to do? Yes, it is. But it gets easier over time. And most times, as the doctor gets used to speaking with you and getting to know who you are, trust me, they will lighten up, especially if they know, hey, this nurse is not a pushover and she has it all together. Remember that.